lecture. I'm Dr. Aurangzeb, consultant cardiologist, and today we will discuss something that is just out of the ordinary, and that is recommendations for physical activity in adults and kids. Uh, are you fitting in at least 150 minutes of heart pumping physical activity per week? This is a usual question that I have asked from most of the attending colleagues during the last few days of my lecture, and the answer is mostly not. So if not, then you are not alone. Only about 1 in 5 adults and teens gets enough exercise to maintain good health. Being more active can help all people think, feel, and sleep better and perform daily tasks more easily. And if you are sedentary, sitting less is a great place to start. And the recommendations for this presentation are derived from the American Heart Association recommendations for physical activity. And we know that their recommendations mentioned here tells us that how much physical activity we need to be healthy, and the guidelines are based on current scientific evidence supporting the connection between physical activity, overall health and well-being, disease prevention, and quality of life. So let's present the full lecture and move on to our further slides. So what are the recommendations for adults? Here, all adults should get at least 150 minutes per week of moderate intensity aerobic activity, and or 75 minutes per week of vigorous aerobic activity, or a combination of both this moderate and vigorous intensity physical activity, preferably spread throughout the week. Also, it is recommended to add moderate to high intensity muscle strengthening activity such as resistance or weights on at least 2 days per week. So while performing aerobics for 75 to 150 minutes per week, also do muscle strengthening activities, for example going to gym or weightlifting or stretching. The details of these various categories of intensity and the types of exercise are coming in the slides that I am going to present later. Also, the most important thing regarding staying healthy is to spend less time sitting, and even light intensity activity can offset some of the risks of being sedentary. Also, it is recommended that to gain even more benefits by being active at least 300 minutes per week. So the more you are active, the more are the benefits. The standard recommendation of 150 minutes per week can be increased up to 300 minutes per week for individuals who can do such an activity without getting symptoms of chest pain or shortness of breath. This will benefit them more with regards to their cardiovascular and general health improvement. Increase amount and intensity gradually over time. Start from slow and then going upward, titrating the intensity and duration of your physical activity. When the recommendation for kids are considered here, we know that the atherosclerotic changes, they do appear in the early ages. Even some changes such as the fatty streak and the early atherosclerotic changes histologically have been found in children less than 10 years of age. So the primary and primordial prevention should start at the earliest age possible, and generally it should begin from the age of 3 to 5 years. And for children 3 to 5 years of age, they should be physically active and have plenty of opportunities to move throughout the day. For kids in the 6 to 17 years old category, they should perform at least 60 minutes per day of moderate to vigorous intensity physical activity, which should mostly be aerobic activity. Here we are going to define the various types of the physical activities uh, and what are their recommendations. So the vigorous intensity activity should be done at least 3 days per week. The muscle and bone strengthening weight bearing activities should be done at least 3 days per week, and increase the amount and intensity gradually over time. So these recommendations are for both children and for adults. So mostly we should not only encourage aerobic activity that will improve their cardiovascular fitness, but also in the uh, uh, 6 to 17 years old age group, we should also encourage muscle and bone strengthening activity at least 3 days per week so that they gain more bone and muscle mass. And coming to what is intensity. So the definition of physical activity is that anything that moves your body and burns calories is called physical activity. And physical activity can be anything, for example, walking, climbing stairs, and stretching, etc. Whatever you can imagine that moves your body and burns calorie is called physical activity. And the most well known and the most well studied is the aerobic or cardio activity. This is basically the type of physical activity in which one gets the heart rate up and benefits the heart by improving cardiorespiratory fitness. When done at a moderate intensity, the heart will beat faster and the breathing becomes harder than normal, but the one who is performing this activity will be able to talk. Also, think of it as a medium or moderate amount of effort. The examples of moderate intensity aerobic activity include brisk walking, which should be at a pace of around about 2.5 miles per hour, water aerobics, dancing in the ballroom or social dancing, gardening, doubles tennis, and biking slower than 10 miles per hour. In contrast to the moderate intensity, vigorous intensity aerobic activities will push your body a little further, and they will require a higher amount of effort. The one performing vigorous intensity activity will probably get warm and begin to sweat. You won't be able to talk much without getting out of breath. And here are some examples of vigorous intensity physical activities. These include hiking uphill or with a heavy backpack, running, swimming laps, aerobic dancing, heavy yard work like continuous digging or hoeing, singles tennis, and cyclings at a pace of 10 miles per hour or faster. Right, so these activities are classified as vigorous intensity physical activities. Okay. Besides the intensity that we discussed in the previous slides, another way to gauge your exercise intensity is to see how hard your heart is beating during physical activity. To use this method, you first have to figure out your maximum heart rate, the upper limit of what your cardiovascular system can handle during physical activity, and you can calculate your maximum heart rate by subtracting your age from 220. For example, if you are 45 years old, subtract 45 from 220 to get a maximum heart rate of 175. This is the average maximum number of times your heart should beat per minute during exercise. Once you know your maximum heart rate, you can calculate your desired target heart rate zone. That is the level at which your heart is being exercised and conditioned but not overworked. As per the American Heart Association guidelines and recommendation, moderate exercise intensity is defined as when your heart rate is increased by 50 to 70% of your maximum heart rate. This is moderate intensity physical activity. And when the heart rate is increased by 70 to 85% of your maximum heart rate, this is called vigorous intensity physical activities. And if you are not fit or you are just beginning an exercise program, aim for the lower end of your target heart rate zone and then gradually build up the intensity. If you're healthy and want to exercise at a vigorous intensity, opt for the higher end of the zone, right? And for maximum benefits, also include both moderate and vigorous intensity activity in your routine, along with strengthening and stretching exercises. For those just starting to get active, don't worry if you can't reach 150 minutes per week just yet, right? Even if you have been sedentary for years, today is the day you can begin to make healthy changes in your life and set a reachable goal for today. You can work up towards the recommended amount by increasing your time as you get stronger. Don't let all or nothing thinking that keeps you from doing what you can every day. So don't be thinking in your mind that, okay, I have been sedentary for the last 10 years and I'm not going to walk, uh, forget about running. So that should not be the case. You should just stop thinking like this. You should just start walking. That's it. And the simplest way to get moving and improve your health is to start walking. It's free, easy, and can be done just about anywhere, uh, everywhere. Any amount of movement is better than none, and you can break it up into short bouts of activity throughout the day. Taking a brisk walk for 5 or 10 minutes a few times a day will add up. So ask your doctor if now what should generally that those recommendations were for younger and for fitter patients who don't have any chronic debilitating cardiac or respiratory diseases. Any patient who have a chronic condition or disability should ask their doctor about what types and amount of physical activity that is right for them and that is suitable for them before you make too many changes. But don't wait, get started today by simply sitting less and moving more, whatever that looks like for you. And the takeaway is that move more with more intensity and sit less, because science has linked being inactive and sitting too much with high risk of heart disease, type 2 diabetes, colon and lung cancer, and early death. It's clear that being more active benefits everyone and helps us live longer, healthier lives. So here are some of the big wins. Exercise lowers the risk of heart disease, stroke, type 2 diabetes, high blood pressure, dementia and Alzheimer's, several types of cancer, and some complications of pregnancy. With exercise, you sleep better, and there is improvement in insomnia and obstructive sleep apnea because of the weight reduction. Also, exercise improves cognition, and the memory is enhanced, attention and processing speeds are improved, and there is less chances of weight gain. Your weight is either maintained at a relatively stable level, or you tend to lose weight if you also observe dietary precautions along with exercise. There will be less chances of obesity and related chronic health conditions. Better bone health and balance with less risk of injury from falls, and fewer symptoms of depression and anxiety. So, what are you waiting for? Let's get moving. Thank you, ladies and gentlemen, for attending today's lecture. I hope that you have learned something from this lecture. If you have any question, please do ask me. And the primary prevention series will continue forward. The next session, inshallah, we will discuss regarding smoking cessation. So stay tuned till then. And if you do like my presentation and lecture, I will recommend you to watch it on YouTube, and also kindly subscribe to that channel as well. And thank you. Good evening to all of the residents, the doctors, and my younger colleagues. Thank you so much.